When the patient was first admitted to the emergency room, his blood pressure and blood glucose were measured, as well as his score on the Glasgow Coma Scale. If a patient's blood glucose reading is lower than 3.5 millimoles per litre, then this needs to be treated and the patient reassessed once the blood glucose is normal.
Jerky movements in his limbs at all?
No, nothing.
Okay. Does he have a history of epilepsy at all?
No.
No. Okay, thank you very much.
Then the emergency room doctor excluded the possibility of a stroke mimic, such as a seizure or syncope. If there is a history of seizure activity or loss of consciousness, then 1 point is subtracted from the ROSIER score. Next, the presence or absence of key neurological deficits was determined. The doctor checked for new acute onset of 1 or more of 5 separate symptoms. For each symptom present, a score of 1 is added. If a symptom is not present, the score is 0. The doctor checks the patient's eyes with a simple visual field test, asking the patient when he sees the white pin coming into view. From this, the doctor can determine if there are signs of a visual field deficit. When the patient is asked to smile, his face shows a marked asymmetry, with weak response on one side and a normal response on the other. When asked to hold both arms out, the patient is unable to lift one of his arms. This clearly demonstrates asymmetrical arm weakness. Similarly with the legs, there is evidence of asymmetrical leg weakness when the patient is asked to lift his right and then his left leg. The doctor assesses the patient's speech and language function, determining whether he has any problems understanding language or finding the right words to express himself, symptoms of dysphasia, or if he has problems with clarity of speech caused by difficulties with articulation. These are symptoms of dysarthria.
No ifs, ands or buts.
Once he has completed the assessment, the doctor calculates the total score on the ROSIER score sheet. The total score can be between -2 and +5. A score higher than 0 indicates the patient is likely to have suffered a stroke. An emergency CT scan should be arranged and the patient should be admitted to the acute stroke unit or referred to the stroke team as a matter of urgency.